In 2008, there was wide agreement that the U.S. needed to do two things: to reduce the number of uninsured Americans and to restrain the spiraling costs of healthcare. Obamacare then made progress on the first, but not the second. Are costs a problem? Consider how much of our economy is devoted to healthcare. In 1970, 7% of the whole economy was healthcare. Today, it's 18%. It's a big increase, but is it too much? Is it a problem? Well, at minimum, devoting more of the economy to healthcare leaves less resources for the other things we need and want. It also has been a cause of the uninsured numbers. As healthcare costs rise, so does monthly insurance, to levels where more people can't fit it in their budget. Any illnesses or injuries can be disastrous. But if the higher spending is making us measurably healthier on average, then maybe it's worth it. Take, for example, our rate of infant mortality, the percentage of babies in the U.S. that die in their first year. Let's compare the U.S. to other countries. In Japan, for example, of every 1,000 babies, on average, just 2.6 die in the first year. But in the U.S., 6.7. Other measures, such as disease burden and life expectancy, show the same pattern. Healthcare outcomes in the U.S. aren't as good as other developed countries. Okay, but maybe it's because in other countries they spend a lot more on healthcare? Nope. The U.S. is far, far above everyone in spending per capita. If it's not getting better health outcomes, the spending must be inefficient in some way. Actually, it's inefficient in a number of ways, and that's what needs to be fixed. There's a couple root causes. The first is that, unlike other capitalistic countries, the U.S. long ago decided to regard healthcare as a commodity, and so historically it's had a completely market-driven approach to healthcare provision. The actors, hospitals, insurance companies, drug companies, all have the incentive and even the duty to their investors to charge as much as they can get away with. And they can get away with a lot when there's local monopolies, complicated products, and very little scrutiny by customers. Think about it. Could you ever know enough to contest a hospital bill? A second cause is Americans' unique love of new technology. Patients and doctors insist on the fanciest equipment and the newest drugs, even when the increased cost has minimal health benefits. Healthcare economists can provide the details, but assuming you can believe these inefficiencies exist, and that the companies making extra profits have no incentive to change, our representatives in Congress need to step in already. Better and stricter rules for the marketplace need to be put in. And centralizing most of the administration and insurance, step by step, will result in economies of scale that cut out the fat. We may hear the scare tactic that this is leading to socialized medicine. But in this country, we'll never have our doctors working for the government. And we're not talking about preventing wealthy families from spending their own money on the most expensive medicine available. No, what we're talking about is fixing a system that's going in the wrong direction. With national healthcare reform, our country will soon get better overall health outcomes, at the same time that we stop the crazy overspending. And we'll have more money for education and infrastructure and other goods and services that we want.